Hi, everyone, and welcome back to the next component of this amazing event. This session is titled The Heart and Soul, Supporting Psychosocial Needs and Exploring the Heart-Brain Connection. My name's Moira Teed, and I'm a Senior Specialist and Lived Experience Liaison with Heart and Stroke's National Mission Team, and I'll be moderating this session. As an engagement geek, I'm thrilled to say that this full event has received the Patients Included certification. And what that means is people with lived experience have actively participated in the design, planning of the event, including the selection of themes, topics, speakers, and they're also speakers themselves. And of course, people with lived experience are in the audience as well. So thank you for attending. And kudos to the planning committee for having that certification. That's hard work. If we could go to the slide about Q&A, how to. We'd like to remind people to please submit your questions with the Q&A icon on the bottom of your screen. And if you have a specific person you'd like to address your question, please include their name before your question so that we can direct it appropriately. So the overview of this session is to share common questions and insights that we're hearing from people with lived experience, including families and caregivers, to share the emerging data and evidence on the heart-brain connection in those living with heart failure, and to discuss potential strategies, solutions, programs, which provide support for those heart-related challenges. I'd like to welcome our speakers today, Dr. Jillianne Code and Dr. Cindy Yip. I'll be introducing them as they start their presentations. And our first speaker will be Dr. Cindy Yip. She's the Director of Data and Knowledge Management, as well as the Heart Program at Heart and Stroke. Cindy's focus is on building meaningful collaborations and boosting public awareness in cardiovascular health. She also has 10 years of biomedical engineer experience specializing in the detection of infectious disease, which is coming in very handy for us right about now. And last but certainly not least, Cindy is a caregiver to a family member who has heart failure. So Cindy, I'll pass the baton to you and good luck.
Thank you very much, Moira, for the introduction, and thank you for HeartLife Foundation for the invitation. So practicing what our last two speakers have already said, let's all just take a deep breath, remember to breathe. I invite all the audience and the speaker to take a deep breath, inhale, and then exhale. And as we just heard, you can do chair yoga. Let's just do 2 seconds of stretch. All right, we are ready for this last session. So thank you for joining us. I think today our Patient Education Day is only the beginning of our support to people living with heart failure. Please join us next month as well on the second National Heart Failure Awareness Week. Yes, national, pan-Canada. Follow our hashtag, amplify the social media messages from 6 credible organizations to raise awareness and share knowledge of heart failure. We need every one of us to help. Next slide, please. Did you know 3 out of 100 people in Canada is living with heart failure? Whether you are a man or a woman. As you tell on this, maybe difficult to see, but the 3 lines is one is for men, one is for women, and one is for both sexes. And whether you are a man or a woman, the trend has mostly stayed the same between 2007 to 2015. That's 9 years of little progress. Next slide, please. These are 3 different lines. Even though the total number of people living with heart failure barely decreased in the past 9 years, surprisingly, the rate of new hospitalization for heart failure during this same period has decreased. This means heart failure patient heart failure may be more commonly diagnosed, but more of them are being managed in the community setting, at home by themselves, outside of the hospital acute care setting. Next slide, please. This really changes the journey of a heart failure patient and their caregivers. Our analysis shows that 73% of heart failure patients leave hospital and return to home, of which more than half did not go home with home care. We have recently launched a survey to better understand what are their needs, what do patients need after they leave the hospital. Early results shows that 33% of the female respondents said they did receive a referral to home care, compared to 0% for male. After leaving the hospital, all the male respondents say they felt like they had enough support at home, compared to only barely half of the female respondents say they have enough. When asked what additional support would be helpful or useful to them, many of them, to no surprise, if you heard from Colleen's session this morning, that indicate mental health counseling is the most needed support. This really speaks to the impact of heart failure on mental health and the lack of support in this area. Next slide, please. Further analysis of Canadian data and scientific research, we also have found that almost 1 in 2 people with heart failure are managing 5 or more other medical conditions. This adds further complexity to our journey, our patient journey, our journey as a caregivers. 1 in 5 people with heart failure experiences depression. An estimated 1 in 4 people with heart failure also have impaired cognitive function. A recent study in 2008 found that there is a significant gap in social cycle and cognitive support for people with heart failure and their caregivers. I am a heart failure caregiver, as Moira has mentioned in the introduction. I myself can totally relate to these early findings. These are data that show real connection between heart failure and brain health. This is not just how we feel. This is actual scientific data showing that. This data show that you are not alone. We are not alone. It's normal to feel that you may not be getting enough mental health support as part of the heart failure care, as part of our journey. You have heard some of this from Colleen this morning, and we're going to hear a little bit more from Jillian in the second half of this presentation. Next slide, please. So why is it that our heart and the brain are so connected while they're so far apart? When the heart doesn't pump enough blood to supply oxygen and nutrients to the brain, it can change the cells of the brain tissue. These cellular changes can have functional impact, which means you may have trouble remembering things, you may have trouble learning new things, or even just staying concentrated. Sitting still for 10 minutes on something could be difficult. This adds stress. And we know stress is not good for the heart. Many of you and your family have to change your lifestyle after having been diagnosed with heart failure. This can be frustrating, can be stressful time. The added demand on self-care or the demand on your caregiver may impact mental well-being, quality of life. You may not want to spend as much time with them. They may be expressing grumpiness at times. And this can lead to social isolation and increased risk of feeling depressed and anxious. Heart and brain connection is a vicious cycle. Slide 12, please. Next slide, please. I'm just actually going to jump to the next slide first. So sadly, with COVID-19 pandemic, it further complicated our journey as patients and caregiver. COVID-19 adds a third layer of this unwanted connection to the heart failure and brain health connection. People with underlying medical conditions such as heart failure are at higher risk of serious complications from COVID-19. While we currently do not know the exact reason behind it, a lot of scientists are working very hard at finding the reason why. Early data from China reported 44 out of 191 which means almost 1 in 4 COVID-19 patients develop heart failure. Shocking, eh? Many of you are taking medications such as ACE inhibitor. Despite some reports, there is no scientific evidence to suggest that heart failure medication may increase your risk of COVID-19. Remember, you should continue your medication unless otherwise instructed by your healthcare providers. Physical distancing, as many of you have heard in the news every single day, it can add additional stress and challenges that can further affect our health. It can further impact this tightly connected heart failure and mental health issues. Caregivers may find it difficult to help their loved one while staying healthy and keeping a physical distance themselves. I myself is doing that as well. Getting medication and keeping a heart-healthy diet may become even more difficult, as you have heard from our previous speakers. Try to explore ways to do online grocery shopping that can actually find low sodium food, that can find food that can help you retain the fluid you need being a heart failure patient. Stay socially connected during this time is also very essential because we know there's a big connection between the risk of feeling depressed and anxious. Can you please go back to the previous slides? Thank you. There are tools and resources out there to support you. I know all those information, it seems very daunting, but because of those information and data, it tells us what we need to act on. And therefore, we have tools to resources to support and help you. Jillianne will speak to some of them in a few minutes, but just want to give you some example of what we have learned from using these tools, which these are some information that we have gathered from 2 heart and stroke online communities, which are the community of survivor and care supporter community. These are online groups that are bilingual and moderated by experts who understand both trauma and online community development. They're closed groups so you can speak candidly and safely, and the community has clear guidelines that were created by the founding members. And it's really great to see everyone in this community supporting each other and giving each other resources, links, strategies, emotional support, kudos, and just lending a virtual hands and hugs. And we learned a lot from them. Organizations like Heart and Stroke and HeartLife Foundation and Canadian Heart Failure Society and other leaders in this area do learn a lot from those communities. And what we have learned, some of the tips we want to share with you is you don't have to do everything alone. It's okay to ask for help. Take social media breaks, meaning after this workshop at 2 p.m., take a break, go for a walk in your house, do that stretches away from that chair. Stay connected. You can message us. You have our contact information. After all this session, you will have all our Twitter handles. Message us. We will respond. Stay connected with us. And if you feel that there are some medical questions that come up because of these sessions this morning, this workshop this morning, give your medical teams a call. Get those answers. Get help. It may take a few tries, but don't give up. And again, self-care is critical. So if you're a caregiver like myself, take care of yourself. I know we're all working very hard these days and we're all trying to stay very positive, but as a caregiver, take care of yourself, then you can take care to the person who is next to you who happen to have heart failure. Next slide, please. Next slide, please. Other possible solution is to be part of a community so that you can actually help increase the awareness of your journey, not just to people like you and the caregivers, but also to healthcare professionals, because they can help and it can help them better understand yourself. You can enhance social psycho support by asking the right questions. Prompt them. Do you have education on mental health? Can you offer me home care? If not right now, when can you? If you cannot, who else can? Ask these people directly. Use technology to stay socially connected, as I have mentioned and Colleen has mentioned. And lastly, share your experience, empower others. It's important to know that you're not alone. And at times I do feel alone and I wonder if other caregivers feel the same way. And I think the most important thing is none of us can do this alone, and we have to do this together. Next slide, please. And with that, I'm going to say to start, the first thing you can do is you can learn from other people like you. And you can learn from them on what you may be experiencing is similar to what they have felt or have experienced. And with that, you can right now learn from Jillian. Over to you, Jillian.
Thank you so much, Cindy. This is a perfect example, I think, of how we can learn from each other. As a caregiver, thank you so much for looking after your dad and, taking care of yourself also, but also doing the hard work to make sure that the community itself is safe. So thank you so much. As I said before, I am a patient, and I've been a patient for a long time, 15 years. But one of the things that has really come to light is that really as patients, living with heart failure is really just not simply a function of the quality of care we receive, or even of the data that our clinicians use to make the decisions for us, or with us rather, but it lies in our ability to understand, engage in, and act on the advice and treatments our clinicians provide. So very much so building upon what Cindy was just saying. Next slide, please. One of the things that we need to do is make sure that our physicians, our medical providers understand what it's like to live with heart failure, what it's like to be a caregiver of somebody living with heart failure. And one of the things that we did is we created a survey about the heart failure state of mind, and what it's like to live with heart failure, and the importance of considering cognitive impairment in that process, and the psychosocial impact that it has. Next slide, please. And that heart failure really is a continuum, and that we live usually beginning with significant devastation of what this diagnosis does to us, physically, emotionally, psychosocially, economically, and for not just for us, but for our family carers as well. I often say to people that heart failure is not an individual disease where it might impact the patient physically, but it is actually a community condition. So what you've seen so far today is that we are trying to speak truth to this power, and hopefully it will give you some hope. Next slide, please. This past fall at the Canadian Cardiovascular Society, we presented a model or an understanding of what it's like to live with heart failure and to be a person or family care of somebody with heart failure. And we talked about heart failure as a continuum from diagnosis to living with heart failure to advanced heart failure. Following that, what usually happens through the advanced heart failure process, there is a bit of a divide between heart failure and transplant, and then what happens after. But really, somebody living with transplant and any of our champions who you see listed here will tell you it is definitely a continuum. And if something happens while you're post-transplant, then you start feeling heart failure symptoms again, should that happen. So we really need to speak about the continuum. Heart failure is always a part of who we are. Next slide, please. So the most significant thing that I'm hoping that we are able to communicate today is that we really need more emphasis and more champions, more focus around mental health. And the survey that we conducted last year with our members in our group was a mental health questionnaire. And thinking about, are you part of a clinic? What is happening? What's going on? Have you been offered mental health support services? And you will see, especially I want to highlight that 72% of people who were replied, who are a part of our group, did not actually have access or were offered mental health support services. Further, even worse, their family carers, a shocking almost 90% of respondents said that the family carers were not offered this same assistance. Next slide, please. So following on that, what kind of support do we need to communicate is needed around supporting us through this incredible journey that we're on? Private one-on-one counseling was one of the biggest things. Family counseling was second. Group counseling, but also online web-based counseling, which, if you have any experience with counseling, but also one of the first things that is offered is anonymous web-based counseling, which the Prime Minister did just announce as well in response to the COVID crisis that we're currently facing, although most people really need the private one-on-one counseling. Next slide, please. Some of the comments that we also received was that these services need to be provided for patients and their families. It's integral in how we function. And ultimately, it does have an effect on our recovery, on our ability to maintain our health with heart failure or any cardiovascular condition. And so access is really important. It is largely non-existent. Sometimes it's couched in what people call quote unquote patient education, which is, here's a brochure, this is your condition, great, have at her. And we know that this is not enough, and it's not suitable. The information is wonderful, thank you, but what do I do now is really what we end up thinking every day. Mental health is expensive, and it isn't covered by our public plans. And for those who are lucky enough to have it covered by their workplace, if they're still able to work, maybe you get a few visits covered. It's hard to get, and many of them you just have to pay up front. So it's really, really difficult. So we need to come together to find a way to make mental health, especially in this space, for us as heart failure patients and survivors, to make it available to all. Next slide, please. So I really want to leave a bunch of time for questions, but I'm really hoping that what you've learned today is that we really need to come together to speak truth to power, and that there is reason to hope. And what you can do as patients and family carers and all of the practitioners in the audience can and does change lives. But that heart failure is a continuum. And because there is no cure for heart failure, we really need to work hard on our mental health and really, really explore and establish that our spirit is the only way at this point, the only cure for heart failure. Next slide, please. So one of the things that the HeartLife Foundation has done since our inception, as Mark mentioned, we actually met at a heart and stroke event in Montreal and Toronto. And it just, what we do as patients is very attuned to and in line with the mission of the Heart and Stroke Foundation. So we have a very strong bond, and we really do aim to continue through a shared leadership to provide resources in however way you can get them. The HeartLife Foundation, we have our website about COVID-19 that we have created at heartlife.ca/COVID-19, and we've curated a bunch of resources there, and we will continue to expand on it. But they are based in science, and they are, excuse me, there for you to access. And anything that we say as a foundation is backed by science, but we also have a medical director, Dr. Sean Varani, who helps us make sure that the information that we provide to you is accurate at the state of knowledge that it's currently at. Cindy, did you want to talk to some of the heart and stroke resources?
Sure. The Heart and Stroke Resources, we're trying to work very closely with all the other organizations to complement what's out there instead of duplicating and confusing the general public. So right now we have quite a lot of resources addressing the connection between COVID-19 to various heart disease. And we're also doing quite a bit of webinars that are targeted to specific heart disease. And as many of you know, the heart failure is also linked to other heart disease as well. So there's so many different connections, and we want to make sure that we can cover all the different bases because it has to be an integrated care in multi-area as well.
Next slide, please. We also have a number of shared communities to support you. Many of our members are members of all of these communities. With lots of different ways to communicate and get information. We have our HeartLife Help for Hearts group, both for patients and family carers. As well, we have an affiliation with the Canadian Women with Medical Heart Issues run by Jackie Ratz. And so there's a lot of women who of all stripes of cardiac disease in that group, seeking out support in ways only women can, as well as we are members, and there are resources through the Heart and Stroke community of survivors. Do you have anything to add to that, Cindy?
No, I think the last message I want to add is the community needs to work together, and any suggestion from any of the audience is much welcome, because Jillian and I and both of our organizations are definitely looking to evolve and improve and to better support all of you.
Yes. As Cindy mentioned, the Heart and Stroke group is facilitated by their experts and moderated as well. And the HeartLife and Canadian Women's Group are both patient-led and patient-driven. So we don't allow experts. These are physicians, etc., into our group. So it is a very private patient-only thing. So you can even talk more freely. Next slide, please. So we have time now for lots of time for questions. And so Moira, I think we'll pass it back to you.
Sure. Yes, thank you. And I'm not going to let you get away without me tooting your horn for you there, Jillianne. I wasn't able to introduce you, but for those of you who don't know Jillianne, I'd be surprised if you don't, but if you don't, she is the co-founder and president of HeartLife and a 2-time heart transplant recipient and a heart failure survivor, as well as an assistant professor at the University of British Columbia, former postdoctoral fellow at Harvard University, and keynote speaker, blogger, advocate, promoter, all of the above. And so knowing Jillianne has been an honor for me, and I think we're all now part of the Jillianne family for being involved today. So I want to thank you both for your excellent talks today. I do have some great questions here. One moment. Here we go. So the first question is something we hear typically, and I could probably respond based on our online peer support communities from Heart and Stroke, but as a young person with heart failure, would online support groups be suitable, is the question. I can speak to the 2 online communities we have. We have people with lived experience all the way from early 20s on to 65 plus, and actually the most members are in their 30 to 45 range, I would say. So certainly lots of peers that would understand common issues that young people with lived experience may be facing. Any thoughts, Jillianne?
Absolutely. Thank you, Maura. Yes, the HeartLife group is more specific to heart failure, but we do have, as Cindy was mentioning, the underlying disease that causes heart failure is vast. So we do have a number of people of all ages, stripes, and genders who do participate in our group. I think you saw earlier one of our champions, Sunny, was 18 when he was diagnosed. And so it really does run the gamut in terms of what it's, the expertise, the lived experience expertise across our groups. And so absolutely, you can join and you can just lurk. You can actively participate by posting questions. In HeartLife, we do have weekly virtual hangouts. So if that's your thing, you can join in virtually via Zoom and talk to some people and just, have some tea or half a cup while limiting your fluid intake and talk about what it's like. And so there's lots of options.
Awesome.
And we would welcome you anytime, of course.
And I just want to jump in to also say that there is really no age limit for the online support group. All are welcome. And what we have observed is, because we don't have a delegate group for a specific disease, because we do want to make sure that there is integrations, because there's just so much connectivity biologically of these diseases. And we are promoting integrated care. So what we do find is people do organically find themselves. So like we do see, I mean, I don't, but that's what I hear from my moderator, because heart and stroke staff is actually not allowed to go into those closed, safe space. Those are purely for people with lived experience and caregiver. But what I'm hearing is that, people do find themselves and they start gravitating and they start sharing strategy and making new virtual friends. Yeah. So I think that's an important part, right? You may become friends with someone with congenital heart disease who happen to end up developing heart failure. I think that's a very important experience to learn. And I also just want to emphasize that the online platform we offer do not have medical experts on it. When I was referring to the moderator, I know I wasn't quite clear. It's just actually not even a heart and stroke core staff. It's just to help with kind of directing, the platform. And Maura will actually can speak more accurately about that. And since I'm not allowed in, I've been banned.
Yeah, the moderators basically remind people of the guidelines that they help to establish in the beginning, if ever needed, and welcoming new members. But the community is a self-sustaining entity, and the community holds each other accountable, and we don't need to moderate very heavily at all. I want to thank you both for such detailed responses to that question, because we want to make sure people aren't alone, and I think that's such an important message from today. So thank you. Cindy, there's a message for you, a question from Carolyn Thomas, who is an author and blogger and amazing advocate as well. And her question is about your slide. After hospital discharge, all male heart failure patients said they had enough support at home, but only 54 of the women said they did. Do we know how this support is defined? What do they mean by support? And is there a difference because men have wives, perhaps?
Wow, what a great question.
Yeah.
And thank you, Carolyn, for joining us and also for following us on Twitter. Really always love to hear and see your hashtag, your handle, Sisters. Great question. So yes, support is defined in the survey, and it is defined as home-based support or services upon leaving the hospital. That includes nurses or attendants care, Meals on Wheels, homemaking support, and interim supportive housing setting, or any support services that was arranged by your health care team. So we have spelled it out specifically for that particular question in the survey. Now, what we are not able to answer at this point, partly is, first of all, we're still very early in the study, and like everything else, it has been put on hold and get interrupted by COVID-19, unfortunately. So hopefully we'll get more respondents soon. once we return to normal. And secondly is, this is the first time we even get data, so I think there are a lot of work we still need to do to understand what is causing this difference. This is the first time we even report, or at least we haven't even reported, we just got the data and saw the difference, to be very honest. So I think lots of work to kind of try to understand what is causing this difference. But I would say, you know, it's very well could be, typically, you know, men tend to have wives and women may tend to be more of the nourishing role biologically or culturally. So there's all those cultural, social, economical, sex and gender differences that may lead to this outcome, but cannot conclude at this point, unfortunately.
Thank you. A very great follow-up question is, should I allow home care into my home during COVID-19? What do I need to consider before doing that? Any thoughts?
That's a great question. That's an excellent question, actually. I think we do have a number of our members who do have home care, and who one actually who I spoke to just last week who just got out of hospital, and so his only option, because he's on dialysis and you know he's a heart failure transplant recipient, is to have home care, and so he does continue to have it, but they're very careful. You know, the people who come in are fully gowned, and they're very careful that way, and so you still need to have the care if you need to have the care. So I would ensure that you make sure that they are adhering to all guidelines, and if they're healthcare professionals, I would assume that they would be. But wherever possible is the recommendation to you know to say to be physically distant. But in this case, it wouldn't be. We did have a session last week as well with Dr. Sean Barani, and we had a number of our people specifically about heart failure and COVID-19. It's on our YouTube channel, the HeartLife YouTube channel, and we will be tweeting it out as well. And he gives some advice about all of these kinds of risk, social distancing or physical distancing while maintaining social connections, and how we can work with being careful around infection and these kinds of things right now. But that would be my advice. But definitely consult with your team.
And would you recommend, Jillianne, speaking to the agency that's providing the home care to understand their protocol so that you know what to expect before they come in? Is that okay?
Yes, yeah. Be completely familiar with all of that information. So knowing which questions to ask, even if you're not even sure, even ask these questions of our group. There are a lot of people out there who do have home care, and so what are they doing, and be very specific about that, because the best patient is an informed one. And so don't assume, just ask, do ask. Absolutely. Thank you, Maura.
And would you also say that healthcare provider really do appreciate an informed patient? It makes their job also a lot more easier too, right?
Hopefully. Yeah.
I think so. And I think the bottom line is just don't be afraid to ask.
Yeah.
Explore your options.
Do either of you have any tips on how to talk to kids about your health conditions, about heart failure specifically?
That's a great question. That's a really good question. Since a number of our members are, as we now know, do have kids, have young kids even. And I think one of the things is being, as open and honest as you can with them without, scaring them too much. I know yourself. You're probably really frightened about the whole concept of being in heart failure and what that means, and initially thinking, oh my goodness, am I going to die? Which no, you're not. But it's a chronic condition that needs to be managed just like any other. And so, trying to explain to them as best you can your limitations, or my heart just isn't as strong. Those kinds of things. One of our partner organizations in the UK, Pumping Marvelous, they actually created a short video. I think it's like 10 minutes long, something like that. And this is exactly what they did, is they interviewed kids. And so we will provide that as a resource as well, to hear from them, from the kids' mouths, saying, well, this is what it's like when my mom or dad, have heart failure. And so they're very candid, and it's really brilliant. But yes, they appreciate honesty. Kids know when you're not being truthful.
Awesome. Yes, they do. And I think we also have a resource when it comes to speaking to your children about COVID-19. So I'm not sure if that's the angle people were coming at, but we do have a resource from the Center for Addiction and Mental Health available on our heartandstroke.ca website as well, under the COVID resources. So in case that was the underlying question there.
That's actually good. Thank you for mentioning that. It just triggered my memory. A colleague of mine at the University of Victoria, Dr.Jillianne Roberts, she's a child psychologist, and she did a fantastic interview on CBC about talking to kids about COVID-19. And so it's actually it's about 20 minutes. I will dig up that link and I will send it to you. And yes, great. That's a good question. Good follow-up.
Yeah, and that's an excellent question. It's a tough one too. And I remember when my sister-in-law passed away, and it was a very difficult thing to explain what is an aneurysm, what is a blood vessels. So definitely, there's a lot of resources out there. In addition to Pumping Marvelous videos, I think that was a fantastic video to explain to kids what heart failure is about. There are also other resources like Heart Smart Kids, which I have shared in the chat forum there. It's 3 little books that at least you can kind of gently introduce the concept to children. And those are all free, available to anyone in the general public. So explore those resources as well.
Yes, Heart Smart Kids is www.hskids.ca. Because I'm not sure if everyone sees the chat there, but that's where you would find that information. The next question, it's a bit of a two-part. There are 2 questions here related. So how do I advocate for mental health supports in our clinics or hospitals that do not have such support? And then, is there any evidence that heart failure is related to emotions, for example, crying or emotional lability? Any thoughts on either of those questions?
Lots of thoughts. Advocating and asking for the resources that you need is definitely something to do, to find out if there are counseling services available, social work as well, and often overutilized and under-recognized profession. They do offer some counseling as well. But one of the things that we are trying to do as a foundation with as HeartLife is to advocate and to really get the community, the broader community, to understand that there is a lack of recognition and a lack of resources driven towards mental health and psychosocial support. And so a big reason why Mark and I started the HeartLife Foundation was because of that, and why the support groups are so essential and so important, and why they are growing. Every day we're having more and more members join us. And so it is really important to seek out that help And sometimes when it's there and you don't know, so asking, telling your doctors, your nurses that you are struggling. They will try, I think, to find some resources for you, hopefully. But also to get involved with HeartLife, because one of our biggest pillars, and all of the initiatives, the good number of the initiatives that we have moving forward are around mental health and advocating for mental health and resources for mental health, and for cardiac patients and heart failure patients in particular. Crying, being in heart failure, being depressed, having episodes of crying is normal. And yes, I think expressing yourself and releasing some of that anxiety and some of that tension, and the why me, and all of that, through crying is completely natural, and it is normal, and it does happen. If you ask my husband, it happens a lot. But if it's bothersome, and if it is hard, you find yourself doing that a lot, then it might be time to reach out. And we do have some resources. If you weren't around for Colleen's talk, and Colleen, feel free to jump in here if you are online as well, to help you work through some of those things. But yes, I don't know if there's evidence per se, but I can certainly tell you from personal experience, there have been many tears.
Yeah. And I'm being reminded that the May 4th webinar, that's also a collaboration with HeartLife, is about heart failure and mental health. So we can delve a bit deeper into some of those questions moving forward. We have one final question. I know we'll run over, but boy, do I want to get that last question answered. So I have done my due diligence. So it's just really in line with the anxiety piece too. So my regular checkup has been canceled, feeling like I'm in limbo land here with anxiety because of COVID-19. It was canceled. What can I do to manage my own health in between these canceled appointments?
Mm-hmm. That's an excellent question. If your appointment has been canceled for whatever reason, see if you can contact your team, your doctor, to see if you can have a remote visit, or even a telephone visit, a conversation. If that's not possible, or if you are not on the urgent heart failure list, then that's actually good. But continue maintaining your health by looking after doing as much movement, as Karen and Greg Gord so aptly discussed today, about maintaining that part of exercise, moving, looking after your mental health, trying to do that through exercise, but also following some of Colleen's advice. Also, don't stop taking your medications. Continue on as if your next visit was going to happen, right? So just maintain. Do your best to eat as well as you can, and reach out. So connect with us online, and we will support each other through this. So really, that's the best thing that I can say, is just keep on keeping on, and do your best, and stay connected.
Yeah, and I would say keep those questions coming. Even when this workshop is done, I think both of our organizations are still continuing full force while working from home, to answer all the public queries and all the questions from the general public. So definitely that's how we learned that people were worrying about whether they should take their heart failure medications or not. This is how we learn to see whether the evidence actually matches to what's actually happening, because sometimes scientific evidence may not, and we need to understand why. So keep those questions coming and keep sending us email or tweet us. And I think the last tip I would like to share as something that's happened to me a couple of weeks ago is often you may get a phone call from your clinic, from the receptionist telling you that, oh, your loved ones or your appointment has been canceled. And then next thing is they will hang up. And really all you really need to do is like, hang on a second, I got one question. I know my appointment is canceled. Would you be able to get Dr. So-and-so on the phone with me? Or would you be able to get nurse so-and-so on the phone with me? And then talk about your feelings. A lot of these appointments are usually worrying about your blood pressure, your clinical presentation of the disease or of your heart conditions, but not so much about how you feel. So take the initiative to talk about the feeling, doctor or nurses or health teams, I am feeling very anxious. Yeah. Someone else you can direct me to, can I set up an appointment with the social workers, etc. Ask those questions, because all of us are so busy and there's so much going on right now. By asking that question, you're helping yourself, you're helping your caregiver, and you're also helping the health team frontline workers who are risking their lives to save your lives.
Yes, absolutely. Thank you, Cindy. Also, one final thing I really want to stress and emphasize: if you find yourself decompensating, meaning you can't shed that extra water weight, you're finding it difficult to breathe, you feel like your heart failure is getting worse, then please, and you can't contact your doctor, please go to the emergency, go and get yourself checked out. Dr. Andrew Cron, who's the president of the Canadian Cardiovascular Society, just spoke, I think yesterday, the day before. Our hospitals are doing such a great job across the country managing COVID that there's been a significant, and telling people to stay home, that there's been a significant drop-off in cardiac visits to the hospital, and they are really worried that people aren't seeking the help when they need it. So please go to the hospital if you think you need that help and you find yourself suffering. There's no need to suffer.
Yes, that is definitely a huge concern on both the heart and the stroke side that we're hearing, that people may be less inclined to go to hospital for fear of contracting COVID-19. And if you have a health crisis, that is what the hospital is for, and they will keep you safe. You need to get medical attention if you have those signs and symptoms. So please don't hesitate. So we will now leave it to a break. Breaks are important. And then it's a more open dialogue and question and answer. So hopefully a lot of those questions we were not able to answer today, we can still get to. I wish everyone a great break. Thank you so much.
Thank you, Moira.
Thank you.